Hello, students. Welcome back to Next Level Academy. Step up your career. Today, we are going to see JIPMER Skill Test Part 4 2022. The topic is Adult CPR. Suppose if you are seeing a patient or a victim who is unconscious, what do you do? First, you have to check for the scene safety because the patient might have experienced shock or some accidents or whatever it may be. So you have to check for the scene safety because our safety is very important. And next comes to the patient safety. You have to check the patient responsiveness. You have to tap the shoulders of the victim and you have to ask, are you okay? Are you okay? If the patient responds, then it's okay. If he doesn't respond, then you have to call for help. If someone is nearby, you can take help from them or through them, you can call the ambulance or the emergency medical team. If you're alone, you're the only one rescuer, what you have to do is you can better take the mobile and you can call the emergency medical team or the ambulance. Before 2014, what happened was they were practicing for CPR, airway, breathing, and circulation pattern. This was the sequence they have practiced. But Finland, they done a research on it and they found that circulation is taking late. So they decided to change this pattern to circulation, airway, and breathing. So after 2014, they have changed to CAB. First comes the circulation, next comes the airway, and there it comes followed. For starting CPR, you have to lay down the patient on a flat surface or in the ground. You have to check for the carotid pulse. The right side is the either side of the Adam's apple. This is the point. You have to feel with the two fingers, your index and the middle finger, and you have to make an imaginary line between two nipples of the victim, lower end of the sternum. This is the imaginary point. On the point, you have to make a interlock with your two hands, and with the heel of the hand, you have to give to start compression. The angle you should be 90-degree so that the CPR will be effective. You will face downwards to the patient and you have to start counting 30 is to 2. So the compression has to be at least 100 compressions per minute. So when you give compression, what happens is the blood supply will be perfused to the brain. So you will prevent the patient from brain death. Following the 30 compressions, you have to give 2 breaths. For that, you have to head lift, chin lift the victim's head, and you have to first see for any foreign body lodged inside or not. If any foreign body is lodged inside the airway has to be cleared. If it is visible and if it is feasible, easy to take it out or sweep it out, you can put your index finger and the middle finger. With the index and middle finger, you can sweep it out. If it is not visible and if it is not easy to take it out, do not let your finger inside. You may lodge the foreign body further inside the airway tract. So the patient will further suffer for airway tract, further suffer for the airway disturbance or obstruction. You have to give 2 breaths that will take 2 seconds. So while you give breaths, you have to check for the chest inflation so that you'll confirm that the airway which is given it is successful. So you will repeat the same 30 compression is to 2 breaths for 5 cycles. So you'll give compression, 30 compressions, and you give 2 breaths. And again 30 compressions and 2 breaths for 5 cycles or 2 minutes. After that, we'll check for the carotid pulse again. If the pulse is present, we'll stop to give CPR. You should not give CPR. Otherwise, the heart may get collapse. If it is not present, if the carotid pulse is not present, we'll continue to give CPR till the emergency team arrives. When the emergency team arrives in the mid of your compressions, you should not stop it. You have to continue it because it has to be an effective CPR. Suppose if the pulse is present but respiration is not present, you have to give breaths. 1 is to 1000, 2 is to 1000, 3 is to 1000, 4 is to 1000, and 5 is to 1000, 6 to 1000. So you will give the breaths 5 to 6 breaths continuously. If the patient has restored the carotid pulse and the respiration, you will put the patient in the recovery position like this on the lateral side so that the patient will not aspirate. If any secretions comes out, it will be drained outside. So there are some cardinal features of chest compressions which you have to follow for the effective CPR. First, when you give compression, the depth has to be 5 centimeter for adult and 4 centimeter for the child. It has to be, well, giving compression, while relaxation, the chest has to recoil. Only then the compression will be effective. So the blood flow will be effective to the brain. So these are the cardinal features of the chest compressions. Our first one is push hard, push fast. Second is compression should be at least 100 counts per minute. There should be minimum interruptions. So that's the reason every 5 cycle after they'll check for the carotid pulse, not for every 30 is to 2, not for every 30 compressions, 2 breaths, they will not check the carotid pulse because there should be minimum interruptions. You have to allow for the chest recoil. So once again, I'll repeat it. Your effective CPR, when you follow these cardinal features, there'll be a good perfusion to the brain and the brain dead will be prevented. It is in your hand how you're going to give the CPR on your skill test. Thank you, students, for cooperating with me. I hope I would have explained you and you would have understood. Thank you once again and all the best for your skill test. Please do like, share, and subscribe Next Level Academy and support us. Thank you.